So, hi Paul, thank you so much for joining us. I know we'd booked you in for our partnership day within MHSOP, which is held in our big conference hall in Highbury. So obviously with things as they are at the moment, we can't have it in that format anymore. So we thought we saw one of your chat pods with John Brewer and thought it was good. So thought we'd just have a chat if that's all right. How are you? How are you getting on?
I'm doing all right, thank you, Helen. It's got used to these different ways of working. I think seem to spend a lot of time looking at computer screens, which brings issues of its own, I think. But there's so much. I know it's been very strange and challenging times for so many people, including many of our staff and volunteers. But there's also some things that seem to have come out of this that have been really powerfully positive as well. So I'm kind of in a strange place of sometimes feeling very tired, but sometimes feeling very energized by everything that's going on.
And I think there's probably a similar feeling with a lot of people. You sort of go up and down with different feelings and stuff, don't you? So what, in terms of like the positive stuff that you feel might have come out and might be carried forward through this pandemic time, what sort of things have you spotted or highlighted?
Well, I think there's some really interesting things. First off, one of the things that struck me is that at the start we had so much that we needed to very, very quickly do differently. It was really important for us just to be able to get those messages out and then just trust that our staff got on and did it. And that's exactly what everybody did. And I think that if we sort of compare some of our organizational nervousness before the pandemic around letting people just get on and try things differently and make the transformations work with what actually happened, I think we've seen that we need to be able to just trust our people a bit more. I think also tied in with that is a recognition that our processes often slowed us down and sometimes got in the way. And whilst obviously we need to still do things in a way that we know that we've got good oversight on them, actually having proportionate processes is going to be really important for us to hold on to. I mean, the whole thing about the speed at which we managed to roll out Microsoft Teams across the whole organization, it was unthinkable 3 weeks before we did it. So I think some of that transformation and the way that we've been able to do it, we need to hang on to. I think.
Sorry.
No, you go.
I was just going to say, in terms of the things that we're carrying on with, and staff, trusting staff to carry on, to innovate and do things themselves. In terms of processes, is there going to be anything within the trust in terms of I know internally within MHSOP we've done a learning log where surveys been sent out to staff and what have you. But is there anything sort of trust-wide in terms of processes, overall processes and stuff?
Absolutely. So one of the things that we did at the board level was make sure that we kept the executive team were keeping a really clear log of decisions that were taken throughout the response to the pandemic. So decisions on things that we were stopping doing, things that we were starting to do differently, kind of thing. And that decision log is being reviewed by what we've called a recovery cell that is basically looking at, rather than just doing that default of right now, let's just go back to what we had before. It's actually really making sure we understand the decisions that were taken, but also to reflect on the ones that were right, the ones where it didn't quite work out right, or the things we want to go back on. And I think we've just launched a kind of a piece to get feedback from staff about staff experience, the KISS piece. So what do we want to keep? What do we want to improve? What do we want to start? And what do we want to stop? And I think that's really important because from where I'm sitting, there's things that I might think are improvements, but actually staff in different services in different parts of the organisation might have a different experience of that.
And so in terms of those sort of positives and challenges, so they're all going to be reviewed. And in terms of just sort of stepping back a little bit, because obviously you're new to our trust, what, as chair of a trust like this, or any trust really, what is your role? What do you do on a day-to-day basis?
Yeah, it's been a really interesting way to start a new role. So I think it was week 7 that the pandemic sort of really meant that we had to start doing things differently, and for some of what I do, that's been helpful. For some of it's been incredibly frustrating. So in terms of my role, what I try to do is to work with the board of directors, so the executive team and the non-executive directors, to really look at the strategic development and growth of the organisation. And a key piece of that is about the organisational culture and how we enable Nottinghamshire Healthcare to be the very best place that people want to come to work in. And want to come to volunteer with. And that's something which is complicated. We're a big organisation. We've got a wide range of services and some very different services. But from my perspective, a key bit is trying to enable us to understand what's the sort of culture that we want, thinking about the values work that's already been done, and doing my best to support the executive team to enable that to happen. And within that, there's things that I'm particularly passionate about as a chair that I bring in. And some of those are, again, linked to the culture of the organisation. So I'm absolutely passionate about staff engagement and involvement. If we're trying to make changes, changes don't succeed by trying to impose them from the top. They work by us engaging with our staff and saying, what is it that will work? And again, there's masses of learning from the last 3 months when we've been able to say, grief, we need to stop doing this in a particular way. How are we going to do this differently? And it's staff who've come up with those innovative ways of doing it. Yeah, and whether that's delivering frontline services or things like, the changes to our procurement processes, which were led by our procurement team. Fantastic work. And we're not going to go back on those. As we talked about some of the IT work, some of the support work, that's all of those different pieces. I think tied in with that, another of those kind of cultural pieces for me is our engagement with our service users and our patients. And my career background was in the third sector, and included working for a number of national charities, actually in the day, including Age Concern England. So I did have a lot of, I had roles with Age Concern England.
That's a big passion for our MHSOP services then.
Yeah, absolutely, absolutely. And and I one of my responsibilities was for the engagement of older people within the services across all of the local age concern groups, and that drove in part sort of my passion around the importance of service user involvement, and it's something that I bring into the trust as well. I think another thing that I would mention, which has also had some importance during the last 3 months in particular, is I'm a passionate advocate around equality and diversity. And just before the pandemic actually arrived, I was able to meet with our BME staff network in person. And I was really pleased to be able to do that, but work with our staff networks, whether that's the BME network or our LGBTQ network, really important for me. And again, as a trust chair, I think that cultural piece about us making sure that we're an organisation that, for me, it's about people being able to bring their whole selves into the workplace, whatever that means. I know that if people are able to do that, they're happier in their work and they deliver better services. It's very straightforward for me. But again, it's something that I'm really passionate about. And as a chair, I've got an opportunity to hopefully influence that in terms of the organisational culture.
Fantastic. And just to round up, really. So obviously, it's great to hear your background with older people. And obviously, given our aging population, the health needs of our older people are becoming more critical. So how do you see the future of MHSOP within our trust?
Yeah, I think it's a really interesting question. We know the demographic data in that hopefully many of us are going to be living longer, which is great. What that also means is that we are also seeing far more people living longer with multiple long-term conditions, both physical conditions and conditions around mental health as well. And I think that it's clear that demand on the service will grow, and we need to be prepared for that. But I think we also need to be able to take that holistic view around those who need our services, and physical health care as well as mental health care and broader well-being are going to be increasingly important. And I think, again, unfortunately, that is going to have been heightened by the experience of many people of the last 3 months. And I know older people who, 3 months into self-isolating, it's really, really difficult. So I expect that we're going to see an increase in demand on services like our MHSOP services. Yeah.
Well, lovely. Thank you ever so much for the chat. It's been really, really good to hear your thoughts. And sorry we couldn't be there in person, but perhaps at one of our future partnership days, you can get to meet some more of our teams and hear a bit more about our services. But when we're back up and visiting again, you're more than welcome to at any time.
I will be across. It's one of the things that I've really missed is that I was just starting to do a whole load of induction visits, and then I had to put them on hold. But as of next week, I am starting to be able to get out into services where, I don't want to be a distraction, but I want to be able to go and meet staff and volunteers, say thank you for what you're all doing, and also to meet those who use our services. So absolutely, I will take you up on the offer. I'm sure I will. So really good to spend time with you, Helen.
Thank you. Thanks for your time. See you soon.
Bye for now.